Welcome to the unit on medical and psychosocial aspects of chronic illness and disability, Part 1. In this unit, we will discuss medical aspects and implications of various disabilities, medical terminology, implications of medications as they apply to individuals with disabilities, appropriate medical intervention resources, functional capacities of individuals with disabilities, environmental barriers for individuals with disabilities, work conditioning or work hardening resources and strategies, and rehabilitation terminology and concepts. Going into the CRC exam, it is important to have a broad understanding of disabilities and medical conditions. On the next few slides, we present lists of various disabilities we recommend you familiarize yourself with. If there are any disabilities you have little familiarity with, we suggest learning more about them. Two good learning resources include the Merck Manual of Medical Topics and the Mayo Clinic Diseases and Conditions database. The following slides list disabilities and medical conditions that you should be familiar with as you prepare for your CRC exam. Achondroplasia, Alzheimer's, amputations, amyotrophic lateral sclerosis, ALS or Lou Gehrig's disease, aneurysms, aphasia, arthritis, asthma, ataxia, autism spectrum disorder, Bell's palsy, blindness, cancer, cerebral palsy, chronic fatigue, chronic pain, COPD, cystic fibrosis, deafness, Down syndrome, decubitus ulcers, diabetes, encephalitis, end-stage renal disease, epilepsy, fibromyalgia, glaucoma, Hodgkin's disease, Huntington's disease, hypertension, macular degeneration, Meniere's disease, multiple sclerosis, muscular dystrophy, myasthenia gravis, paraplegia, quadriplegia, Parkinson's disease, poliomyelitis, spina bifida, spinal cord injury, stroke, traumatic brain injury. In this section, we will review the basics of the central nervous and musculoskeletal systems of the body. In addition, we'll give you the opportunity to familiarize yourself with medical terminology you may encounter as you practice in vocational rehabilitation. The central nervous system is comprised of the brain, brainstem, and spinal cord. Together, they receive and transmit information that enables an individual to function. Functional limitations caused by a traumatic brain injury depend on the area of the brain injured. Cerebral cortex, or frontal lobe. Functions include consciousness, initiating activity in response to the environment, judgment, emotional response, expressive languages, assigning meaning to the words we choose, and memory for habits and motor activities. Parietal lobe. Functions include visual attention, touch perception, goal direction, voluntary movements, manipulation of objects, and integrating different senses to allow for the understanding of a single concept. Occipital lobe affects functions of visual processing. Temporal lobe. Functions include hearing and memory acquisition, some visual and spatial perception, and categorization of objects. Brainstem. Functions include breathing, heart rate, swallowing, reflexes related to sight and hearing, such as the startle reflex, controls sweating, blood pressure, digestion, temperature, affects level of alertness, ability to sleep, and sense of balance. Cerebellum. Functions are the coordination of voluntary movement, balance and equilibrium, and some memory for reflexive motor acts. It is also important to pay attention to the spinal column. The location of an injury to the spinal column plays an important role in the prediction of the limitations associated with the injury. Functional limitations are related to the nerves affected at and below the site of injury. There are 33 vertebrae in the spinal column. Cervical spine, or neck, 7 vertebrae, C1 through 7. thoracic spine, upper and middle back, 12 vertebrae, T1 through 12. Lumbar spine, or lower back, 5 vertebrae, L1 through 5. Sacrum, 5 vertebrae, S1 through 5. Coccyx, 4 fused vertebrae. Injury to the neck, C4 through 5 vertebrae, is most common. Around 90% of work injuries are to the lower back, L4 through 5, and L5 through S1 vertebrae. We recommend you familiarize yourself with the parts and function of the eye. Look under the additional resources that are available for this module for the link to the basic anatomy of the eye video. This video provides a brief overview of the anatomy of the eye. The musculoskeletal system of the body is comprised of the body's bones, muscles, and connective tissues, which includes ligaments, tendons, and collagen fibers. This system provides support to the body, protects internal organs, and enables movement. Look under the additional resources that are available for this module for a link to a brief video overview of how the body's skeletal structure and musculature work together. We encourage you to familiarize yourself with basic medical terminology. Look under the additional resources that are available for this module for links to these resources. While we can't verify all of the content available at these sites, they are useful tools for exam preparation. Shepherd Software, to learn medical terminology. Quizlet, basic medical terminology. Mayo Clinic, diseases and conditions. Remember that medical terminology may be a rather small part of the CRC exam. Use your time wisely. With the large number of medications available, it is not possible to be familiar with all of them. There are databases available which list commonly searched drugs. These may be beneficial for you to review. We recommend paying particular attention to pain medications, as clients with many types of disabilities are prescribed pain medication, which can significantly impact vocational functioning. Look under the additional resources that are available for this module for a list of medications consumers with disabilities may be prescribed. People with disabilities are often prescribed multiple medications to manage one or more conditions. Learning more about the medications prescribed to individuals with disabilities helps us to better understand a condition, its treatment, and how it may impact job development. It is important to know how prescribed medications are properly taken. Dosing and distribution guidelines, which may vary for children versus adults, any possible side effects they may cause, and if any other prescriptions, over-the-counter medications or supplements may interact with prescriptions. Knowing how a drug works can help us to better understand the treatment of a condition and the reason for the drug's use. Physiological changes due to aging can impact medication absorption rates and metabolism. Medications may be administered in different ways based on individual needs. Medications may need to be administered on a regular schedule, which must be accounted for during job development, including medication management and medical appointments. There are many resources available to assist VR counselors in learning about psychotropic medications. As you prepare for the CRC exam, we recommend you become familiar with medications commonly prescribed for psychiatric disabilities. Two excellent resources include the National Alliance on Mental Illness and the National Institute of Mental Health. Look under the additional resources that are available for this module for links to these resources. Rehabilitation counselors can help consumers improve their overall health and maintain employment by being knowledgeable about the physical aspects of disability, educating consumers about their disabilities, and referring them for appropriate medical intervention when necessary. Many rehabilitation counselors use online resources such as those provided by Mayo Clinic and WebMD to learn about and update their knowledge regarding specific disabilities they encounter when working with consumers. Evidence-based resources for disability information include the Cochrane Collaboration, Agency for Healthcare Research and Quality, American Congress of Rehabilitation Medicine, National Organization for Rare Diseases, Cinol Plus with full text, National Institute of Health Library, Medline. Links to these resources can be found in the additional resources that are available for this module. Staying current regarding the knowledge, expertise, and outcomes of the specific service providers who may work with your consumers can be vital to your consumers' overall rehabilitation experience. This information can be obtained from consumers and their families as well as through networking with other professionals and drawing from their knowledge and experiences. Next, we will discuss the functional capacities of individuals with disabilities and what determines a functional limitation. A functional limitation is an impairment in a major life activity resulting from a medical condition. State and federal agencies provide eligibility-based vocational rehabilitation services to individuals with disabilities. Eligibility criteria include: an individual must have a disability. It creates an impediment to obtaining, maintaining, or improving employment. The individual requires vocational rehabilitation services to obtain, maintain, or improve employment. Receiving Social Security, SSI or SSDI, results in presumptive eligibility. In the state-federal VR system, once an individual is determined eligible, order of selection is then determined. This is based on the number and severity of functional limitations an individual has. In an order of selection, or OOS, when resources are limited, priority for services is given to the most severely disabled individuals. A comparison is made to the general workforce regarding whether the individual is able to functionally engage in activities that most individuals in the workforce are able to perform. An assessment of functional limitations considers whether or not assistive technology or accommodations are already being utilized and if they effectively address the functional impairment. The Rehabilitation Act provides for 7 functional limitation domains, including mobility, communication, self-care, self-direction, interpersonal skills and acceptance, work tolerance, and work skills or work history. Mobility involves a person's ability to move from one place to another at work and in the community. A person may require or already utilizes others or assistive devices as a means to navigate their environment. Communication includes talking, listening, understanding, and reading or writing related to vocational task engagement. Self-care is defined as the ability to perform activities of daily living such as eating, toileting, grooming, dressing, cooking, shopping, washing, housekeeping, money management, and fulfilling health and safety needs as they relate to employment. Self-direction refers to the ability to independently and effectively plan, initiate, and organize work tasks, and to make decisions related to employment. Interpersonal skills and acceptance describes the ability to establish and maintain interpersonal relationships. This also includes acceptance by others. A disability may cause behavior which is difficult for others to understand and accept. Work tolerance is the physical, cognitive, and psychological capacity to meet the demands of the workforce. This may include the performance of the physical demands in a job, for example, stamina, gross or fine motor skills, somatosensory, range of motion, and muscle strength, tone, reflex, psychomotor issues, and so on. Work skills or work history addresses the ability to demonstrate necessary entry-level work skills or experiences to attain employment. We determine whether there are reasonable expectations that a person is able to engage in work activities without training. A negative work history is demonstrative of numerous negative work experiences due to disability, short duration jobs, terminations, poor reviews, and so on. Once an individual is determined eligible for vocational rehabilitation services and their functional limitations are assessed, they are placed in an order of selection category based on the severity and number of their functional limitations. Consideration is also given to the number of services a person may require, for example 3 or more, and the length of time necessary to achieve an employment goal, for example 6 months or longer. This may have an impact on when they will receive services. Order of selection gives priority to the most severely disabled individuals. The assumption is that the lower the severity and number of functional limitations, as well as having fewer than 3 services and/or requiring fewer than 6 months of service provision, the more likely a person is able to help themselves in finding work. As such, these individuals are more likely to be placed on a wait list when resources are low and all eligible persons cannot be served immediately. Universal design, or UD, can be used to reduce environmental barriers for people with disabilities. UD is defined by the Center for Universal Design at North Carolina State University as the design of products and environments to be usable by all people to the greatest extent possible without the need for adaptation or specialized design. Please visit the Center for Universal Design's website to learn more about the principles of UD. The link is located under the additional resources for this module. Remember that environmental barriers can vary greatly for people who have the same disability. It is always important to discuss with consumers the environmental barriers they face in attempting to find or maintain employment. Universal design resources include the Center for Universal Design, CAST Universal Design for Learning Exchange, and the University of Washington's Do-It Center. Please refer to the additional resources that are available for this module for links to these sites. The National Rehabilitation Information Center defines work conditioning or work hardening as an individualized work-oriented process that employs simulated or actual work situations structured to progressively increase work-related strength, stamina, and productivity. Work conditioning or hardening is typically the focus of occupational or physical therapists. However, services offered through vocational rehabilitation can provide insights into consumer readiness, physical condition, to engage in an employment activity that may result in a referral for an OT or PT assessment, such as a physical capacity evaluation. For more information on guidelines for work conditioning and work hardening, look under the additional resources that are available for this module for a link to the American Physical Therapy Association. The following are a few foundational terms in the field of vocational rehabilitation. These concepts are used widely in the field, although there is some variation in how they are referenced. The following terms provide the general conceptual idea which should be recognizable on the exam. People First Language. The goal of People First Language is to put the person first and the disability second. People with disabilities are people, first and foremost. For instance, instead of referring to people as being disabled, it is more appropriate to them as people with disabilities. For more information about and examples of People First Language, visit the Disability is Natural website in the Course Resources document. According to Prince, a general international perspective of disability includes body structures and functions, daily activities, and social participation, and the role of environmental factors, resulting from a physical or mental condition or health problem that may or may not be visible to others and has a limiting impact on their activities. A disabling condition is anything that creates a gap between an individual and the performance of activities and in the environments in which they occur. Lang breaks disabling conditions down in terms of disability, impairment, activity limitation, and participation limitation, and also offers the following example to delineate the distinctions between them. A client has a spinal cord injury or disability. The impairment is paralysis. An activity limitation may be independent use of public transportation, and a participation restriction may be a subsequent lack of or the ability to participate in church. Possessing a disabling condition is as much a product of others' perceptions as it is actually having a disability.